is ferment more than in the carnivores, right? Yeah. Okay. Any questions before we move forward? Okay. Is the last drug part from this part is the drug for treatment of the diarrhea. And for this, we're gonna talk about just only drug to modulate the motility of the GI smooth muscle. There can be two groups together, which is the anticholinergic drugs and opioid. Anticholinergic drugs, they can have the effect both of peristalsis and also contraction, segmental contraction. But for the opioid, they increase the segmental contraction and that cause slowdown of the movement of the GI tract. But again, for this drug group, we not use a lot to management of diarrhea because the most commonly cause of the diarrhea is the infection. And once the infection, we don't want to do the stop GI movement. The first one for that group we're going to talk about is the anticholinergics. Think about like a previous one. The previous one is the prokinetics. We use the cholinergic drug. They're going to stimulate acetylcholine release or stop the function of the enzyme acetylcholinesterase. But this one is work opposite side of that. It just stop working of the cholinergic nerve. So the drug for this drug can be the combined drug. Combined drug include like atropine, metoclopramine, isopramine, scopolamine. But only one drug that approved to use in animal is N-butyrylscopolamine bromide. It's FDA approved to use in horses. What this drug do, they decrease the GI motility. So in case of have the hypermotility in horse, we call the antispasmodics or the spasmolytics. Or the drug gonna stop the signal from the acetylcholine, so the drug gonna stop the spasmodic or a spasm of the GI tract. And also is to reduce the secretion of intestinal epithelial cell. Again, the contraindication for the anticholinergic is any infection GI tract or inflammation GI tract. We cannot use that because it's going to prolong or pathogen inside the body. The second group to inhibit GI motility is the opioid. This opioid is not have the effect at the central nervous system, have the effect on the GI tract. We should only have two drugs together. First is the nifenoxylin, or the commercial name as Lomotil. It's not commonly used. And the second one is a loperamide, or we know as Imodium, or we call as a traveling drug because it stop diarrhea directly. Loperamide is an over-the-counter drug. It's synthetic opioid, and they have the effect only on the GI tract. It stops moving of the GI tract and also have the inhibit secretion on the GI epithelial cell. So that means this drug is good to treat the secretory diarrhea. And also this drug is stimulated to absorb more fluid, electrolyte, and glucose. The last one is not related for the GI motility, but is a mucosal protectants and absorbent. We're going to talk about in the third part of GI drugs. And we use a lot for the acute mild diarrhea in small animal, which is the bismuth subsalicylate, or we know as the Pepto-Bismol. And again, this drug have the subsalicylate, or we know is the substance that made from the aspirin. They can cause a toxicity in cats. So you have to be careful to use in cats because they can cause the toxicity. What the drug do? The drug can absorb the bacterial enterotoxin, and the drug gonna be like protect all the pathogen or the toxin from the bacteria cannot absorb to the system. Because they have the subsalicylate, they can have the local anti-inflammation. Okay, and I think I'm done for the first part of the GI tract. What do you do for the time? So you want break? Yeah, and then we do the second one.